Connect. Arizona Hispanic Connection.
Welcome to AARP Arizona Hispanic Connection for another very informative show. I am your host, David Parra, and this is AARP Arizona Hispanic Connection. The topic today, Obamacare, past, present, future. And we are using Obamacare, believe it or not. We did not used to like to use this name before, but I believe the political implications are pretty much gone to some degree. And it seems like most of the country, I would say, know the the Patient Protection and Affordable Care Act better by Obamacare, believe it or not. It's interesting that how this law, this program, healthcare program, has taken another name pretty much. So welcome again, AARP Arizona Hispanic Connection. The topic today, Obamacare, past, present, future. And before I introduce our guest today, let me remind you that this radio show is being Facebook Live. So if you haven't followed our page, please do. Find us at AARP Arizona Hispanic Connection and follow the page so you can get to hear all these shows and many other things that we post, events that we have. We're going to have a tailgating event, believe it or not, at ASU's game this Saturday. Believe it or not, if you get to the arena by 1:30, you'll be able to find us there. AARP will be there, and you get to eat tacos de carne asada. So that's what we're going to be serving to anyone who visits our site there. Again, the ASU game this Saturday, tailgating event. Again, let me just say the date because I don't want you to hear this program 2 years from now and think that it's going to happen. But today is the 21st of November, 2019. This year is going fairly fast. All right. So let me introduce our guest. Let me make sure the audio looks pretty good right now. The topic again is Obamacare, past, present, and future. And I'm going to introduce our guest. And let me start with you. We have Claudia Maldonado. Claudia Maldonado is Program Director of Keel Health Connections. Claudia, I think this is the first time you are on our show, correct?
It is. Thank you so much for the invitation.
Perfect. Welcome.
Thank you.
Yeah, let me ask you to move the mic a little closer to you and then maybe lift it just a bit so that it captures your voice better. And also, I think I'm going to get your last name right this time, Alan. Let me try. We also have Alan Jersvig.
That's hard. Very hard.
Well, if I read it, I can pronounce it. Jersvig. I just have to eat up the G.
Yes.
And go
No
with
G.
the J. Jersvig. Alan, are you still with the Arizona Alliance of Community Health Centers?
I certainly am.
If you look at the PowerPoint that I sent, I changed the name because for some reason I thought you were with another organization, but nobody will know. Nobody saw that PowerPoint. I'll send you. Well, just change it when you see it. But thank you to both for joining us for this important topic. You know, I am probably, and maybe AARP, we are probably the only crazy ones who usually bring up this topic of Obamacare. Usually not a lot of people talk about it. And I'm kind of proud to be one of those that, because originally, believe it or not, I was running around the state with the message of Obamacare.
That's how I first met you.
Really?
Yeah, I attended one of your sessions. I can't remember which one, but it was year one. And you had your wonderful handout.
The chart, the famous chart.
And then we copied it.
That is awesome. that is actually, you make me feel really good, Alan. Coming from you, that makes me feel good that you basically heard from me the original, the first talks on this important topic. Let me start let me throw a question at you, and let's use a segment or two, actually, because I am of the belief, and I think you will agree with me, that I don't believe that more than 5% of the country really understood the Affordable Care Act.
Oh, I'd agree.
Yeah.
It may not even be 5%.
Right. Honestly, this is only my estimate. At the most, 5% of the country, think about that, understood. They did not even have a chance to understand it because politically it got pretty nasty, pretty ugly right from the get-go. So let me ask you, and either one, both of you, and anyone can start. What has those 9 years been? You know, it's now 9 years, right? Going almost on 10 years.
Well, yes, that's correct as far as when the law passed.
Past, yeah.
We're just now into the 7th annual open enrollment period. Well, I'll jump in and say part of what has happened is politically, it has never stopped being a hot potato or an explosive kind of thing.
Right.
Yet the health insurance marketplace, where you go to buy insurance, if you don't get insurance from work and if you're too young for Medicare, has started to really stabilize and mature in Arizona. It was highly volatile, and now it's been very stable.
Can you explain why? What's changed?
Sure. We started out with like 10 insurance companies
Okay.
in the first couple years.
Actually, I remember it was 11.
Was it 11? I
Yeah.
knew it was
Right,
double
right, right.
digits.
Yeah, yeah.
You're younger than me. You can remember those things, David. But anyway, then it went to just 2 insurance companies in the entire state.
Can you imagine? This is what a couple of years ago, I think.
About 3 years ago
Right.
now.
2 from 11 to 2. That was pretty
And now
crazy.
we're back to 5,
Five,
for Maricopa County.
Okay.
Some of the rural counties only have 1 company. A few rural counties have 2, and then Pima has about 3 companies.
Okay.
But that's one form of stabilizing. We're seeing the same companies come back year after year.
Right.
The other form of stabilizing is the actual rates that people pay have been pretty much flat for 3 years, which means in the early years in Arizona, they didn't charge enough. Then the rates went through the roof, and they kind of stayed there. And so now we're kind of on par with the rest of the country rather than being much lower
Right.
or much higher.
Right.
So that, again, that's another form of stabilizing.
That's a two great items. How about you, Claudia? I mean, what has this 9 years been to you? And you know, it could be from the political side, but even just from the personal. I know you at Kio versus in your case, you don't actually. Well, do you actually help people to sign up, or you're more in the educational arena?
I administer grants
Right.
to organizations like
Yeah.
Kio so they can be trained as health insurance navigators. I'm capable of signing people up, but I prefer not to because I've got my hands full with other
Of course.
things.
So, from your perspective,
Yeah.
Claudia, at Kio, I mean, you've handled. I have to believe at least hundreds of maybe thousands of cases. What has that experience been like in signing people up and the your impression and people's kind of understanding of all these kinds of things?
Well, I've been really fortunate enough to work with some really dedicated individuals. So I've been overseeing the team of navigators that are out actively in the community, signing people up for the marketplace. And I think over all these years and all this time, for me, what's been the most important thing is seeing how it has impacted our community's lives. And I mean it for the better. We've had children with chronic health conditions finally get connected to healthcare. We've had, families and parents. And for me, it's really about the experience of working one-on-one with the navigator and making sure that navigator is really thoughtful and trained and educated to really guide them through the process. To me, that's the most important thing is the guiding and seeing how it has been very successful for many in our community.
You know, I wonder whether policymakers and people who handle the structure of healthcare talk to navigators, because if they did, they would get a firsthand impression of what this means to folks. So you're saying that you've seen people who had no healthcare now have healthcare.
That is correct. And I think what it's really important, it's an important place for Kio to be because we really see the policy, all these things being dealt with
Right.
at this level, and then really seeing the impact within the community. What does this policy truly mean when it hits
Right.
the impacted
Right.
and it hits our community in Arizona? So for me, that's been really powerful. And I've seen it help a lot of people. So for me, that's been really impactful.
So outside of the politics, would you consider the Affordable Care Act, Obamacare, a good thing?
I would say yes, it's been a good thing because it's important for people to have options.
Right.
It's important for people to know that there is something out there available to them that we can hopefully help them navigate through.
Right.
And
Go ahead.
that really sparks a thought. When people hear Obamacare, we're not sure what they're thinking. So just a couple things, because we're now so many years into this. Part of the Affordable Care Act was to expand Medicaid, and we call Medicaid access here in Arizona. More people have been covered through expanded Medicaid, both children, parents, single adults, than have ever purchased insurance in the health insurance marketplace.
You know, and sorry to cut you off.
no.
We have to go on our break. Why don't we follow up on that
Yeah.
point? Let's kind of share with folks those key elements of the Affordable Care Act, which obviously Medicaid expansion is one of them. We'll continue with that thought, but I have to take a break right here. Stay with us. This is AARP, Arizona Hispanic Connection. The topic today is Obamacare, past, present, future. We'll be right back. Stay with us. Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. Amazing topic. I don't know. I feel very passionate about this topic because it's probably one of the first ones as an AARP staff that I touch in a very concrete way. I was running like crazy when nobody literally knew anything about AARP being in Congress, advocating, because we did endorse, as AARP, we did endorse this law. We got a hold of the main points, and AARP prepare a PowerPoint. And then out of that PowerPoint, I created a chart, which basically is the content of the PowerPoint, to make it just in one page. Most of the content in one page. And we run around. We train nurses. We train a lot of folks, and eventually, of course, the navigators came along, and then the navigators pretty much took over. There wasn't as much of a need for AARP to do this kind of work. But I don't know. This is a very important issue. That's why I dare to say that maybe 5% of the country really knew. So let's come back, and I know I cut you off, Ellen. I apologize for that. I had to go on a break. But so let's do a little bit of justice to the Affordable Care Act in this next segment, maybe 2 segments if needed. So the Affordable Care Act has key components, and I believe the key components fall into the category of the actual name: protections and affordability, right? Patient protection and the Affordable Care Act. So it has to be affordable, and it has to protect. So I suppose that the Medicaid expansion is in the realm of affordability. Yeah. Why don't you begin to explain that concept, because I think it's so important, and then we can talk about other items.
Well, just to start with, access is Medicaid here in Arizona, so we'll call it access. Access was expanded so more people would be eligible based on income. Mm-hmm. Say they raised the income level.
Right.
And it really made a big impact on childless adults. Mm-hmm. In many states, even to this day, if you're a childless adult, you cannot get Medicaid.
Right.
and under unless you're basically living without a house. I mean, we're very fortunate here. So hundreds of thousands of people have gotten coverage in Arizona through the expansion of Medicaid. So that's a very important part of affordability. The other part of affordability is approximately 9 out of 10 people that buy their health insurance through the health insurance marketplace in Arizona get financial help. People forget that Obamacare, depending on your income, you get a check from the government to help pay your insurance.
Right. So let's kind of say it a little slower, if you will. So before the Affordable Care Act, people in Arizona, they had to make up to 100% of federal poverty level. Let's just say it's $1,000 per person, just for the sake of the example.
Yep.
So if you made $1,001, you're out.
You're out.
So when the Affordable Care Act came along, what it did, it raised it to 138% of federal poverty. And I know the 133 plus the 5. Okay, so let's just say, so then that means that person could make $1,380. So think about that. If you made 300, in the past, if you made $1, you're out.
Yep.
Now with the Affordable Care Act, you could make $1,380 and still have access. And then you said that the childless adults had no chance before.
Well, actually, Arizona passed childless adults before, but then they froze it, and then it came back
Right.
at about the same time as the Affordable Care Act. So
Right.
it really was important.
Now, how about pre-existing conditions, which I think is one of the biggest thing that the Affordable Care Act did?
So pre-existing conditions are, I think, a pretty significant piece of the Affordable Care Act. So as a result of the law, you could now purchase health insurance, and the health insurance plan and issuer could not exclude you because of a pre-existing condition or not treat you because of that pre-existing condition.
Right.
And that's really important. You know, you might have families with children that have pre-existing conditions or adults with pre-existing conditions. And so to know that that is no longer a barrier to receiving quality, affordable health care is really significant for the community.
Right. You know, it's interesting because the reason why, and the number that was used when the Affordable Care Act actually became law was 47 million Americans without health insurance. And one of the reasons why that means, many did not have insurance is because of pre-existing conditions. You go to buy an insurance plan, and as soon as you had a condition like asthma or diabetes, you're out. They had the right to deny you coverage. And now with the Affordable Care Act, it was prohibited, right? Prohibited that they deny coverage, because you could go dying of cancer and they still have to guarantee you coverage. That's a huge thing, isn't it, Ellen?
Well, it's huge. And some people don't understand that the Affordable Care Act has also impacted their employer coverage. Now, employers with 50 or more employees must provide coverage, but that coverage must include 10 essential health benefits, just as if you buy in the marketplace.
Right.
It will cover 10 essential health benefits. There was no standard in the United States. If you called it insurance, it was insurance.
Right.
And your insurance in one state may be completely
And many
different.
people did not even know what they were getting, the
Right.
benefits.
Exactly.
Right.
So they standardized that if you're a group or if you are in the marketplace, it must cover certain things. And these 10 essential health benefits, I can never tick off all 10 of them.
Yeah.
But they're comprehensive.
Right.
Drug coverage for
I have actually
pregnancy.
the 10. Let me see if I
Well,
can read
thank
them
you,
real
because
quick.
I forgot my
Doctor
file.
visits, doctor visits, emergency services, hospital care, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatment, prescription drugs, rehabilitative services and habilitative services and devices, laboratory services, preventive and wellness services, which is, preventive care is a big thing also of the Affordable Care Act, and chronic disease management, pediatric services, including oral and vision care. So that was standard, as you're saying.
and comprehensive.
Right.
Yes, and I think these benefits are really important to the communities because, when you think of pediatric vision and oral, so many of our kiddos, if they're going to school and they're not feeling well or they're not able to see, how successful are they going to be if they don't have those glasses that they so desperately need? So these kinds of provisions really made a difference.
You know, I have the chart. I have it in front
I'm
of me.
glad you have it today,
Yes.
David.
The premium increases of 10% or more must be justified. So that was another provision of the Affordable Care Act. That means the insurance companies couldn't just increase more than 10% without a justification.
And approval.
Right.
And when I say rates in Arizona have stayed flat, we've seen reductions in the past 3 years. We've seen almost no change or maybe a 2% increase. It's just
Right.
been stable. And people that have to buy their own insurance and get no help, it is expensive.
Right.
But again, let's remember that more than 90% of the people in Arizona receive financial help if they're buying
More
their
than
own.
90%.
Well, right around 90, right there.
That's
9
a
out of
high
10.
number.
Yeah, it is. And that's an important thing. You know, when we were talking about protection,
Right.
one of the other things that most people don't understand is that it's because it's way down in the weeds. Insurance companies in the past could have pretty much unlimited profits. With the Affordable Care Act, insurance companies must spend at least 80 or 85%
Right.
of the dollars they collect on medical care. That means they are limited to about 15% of
Profit.
other profit and other expenses that is not medical care.
And you know, in my note right here, refunds will be given to policyholders. In most cases, I assume the company, the insurance company that is sponsoring
The specific insurance company sends checks
Right.
to consumers
Right.
if they miss their mark and have not yet spent at least 85%.
And I heard of cases. I
Oh, yeah.
did hear of
Yes,
cases that
they
they got a
exist.
refund.
Right.
Yes.
You know, another one, no excessive premiums can be charged, and this is based on age. The ratios, it was crazy. In the past, you know, they can charge an older person 5 times as much as a younger person. So the ratio changed to 3. It says
3 times,
3 to
yep.
1 based on age. 3 to 1 based on age. So insurance companies could no longer just set the prices that they wanted. An older person could not pay more than 3 times the rate of a young person. Another protection.
And particularly when you think of the audience that's 50 but not yet 65. If you're in that age group and you have to go out and buy your own insurance, there's a big difference between having 5 times or more in some
Right.
cases versus 3 times what a young person would pay.
Right. And you know, here's another one. Women cannot be charged higher premiums than men. This is big.
Yes,
This is big.
This is really big for the community because if you think about it, we were basically being charged just for the fact that we were being women,
Right.
and you know we bear the children and everything, and so this really made a difference. You know, as far as you know the how much they were
Right,
going to be
right.
charged. And one other thing I also wanted to mention that's part of the Affordable Care Act is the fact that parents who had employer-sponsored children or employer-sponsored coverage could keep their children on their health plan up until the age of 26.
Right.
That's huge for some of
is.
these parents. You know, you've
Right.
got kids going to college, maybe graduate school. How are you going to keep them insured? This was another option made to them, you know, as a result of the law.
Another excellent benefit of the Affordable Care Act. You know, I have another one. It says coverage cannot be dropped if you get sick or for making an honest mistake in the application.
I love that one because the fancy word for that is rescission. And what was happening is that certain insurance companies, if you would get a horrible diagnosis, they would then look for a reason to drop you.
Right.
And let's say you made an innocent mistake on the application and you were dropped. Let me just raise a note of caution. We now have short-term limited benefit plans that are for sale, and you can get a plan for a full year and it can be renewed for 3 years. However, the short-term limited plans, not only you must qualify for.
Right.
So if you have a pre-existing condition, no
Most
coverage.
likely, yeah.
And if they find any little mistake in your application, they can drop you. And they also have limits of how much they will pay.
Right.
So if you have a qualified health plan through the Affordable Care Act, it's unlimited annual, unlimited lifetime.
Right.
The short-term plans, limited annual, limited
So we
lifetime.
need to warn folks that if they're going to go that route, they need to really understand what they're buying. We sometimes call them the skinny plans.
Yep.
They do not cover the 10 essential health benefits. Most likely, if they have a pre-existing condition, they're not going to respect that, and they're not going to offer the coverage. We have to go on another break. Let me just say also, I used to say in my presentations that if you smoke, you will get smoked. and basically by that means that according to the Affordable Care Act, people who smoke pay 150% of the premium of a non-smoker. So let's say I don't smoke, I pay $100, somebody would pay 150. So if you smoke, you will get smoked. So you already touched the matter of the children being on the parents' plan until they turn 26. Two more before we actually take the break, and one was that there's no coverage limits. Right? No coverage limit. So there used to be a yearly or annual limit, meaning, oh, I already spent this much on you, you're out of luck, or lifetime, and they would drop you. No more. They have to cover as much as you need to on a yearly basis and on an annual basis. They have no ground to cancel your coverage. And let me see, the last one. The last one is very important. Free preventive services. I usually ask my kids, do you go to your annual checkups? And one of them says yes, the other one says no. I says, you have got to go. I do it every year. I go take, because it's free. And by the way, if you go do your preventive services, do not allow them to charge you the copay. They're
Right.
not supposed to, because they did it twice to me, and I had to let them know, excuse me, is this preventive? Yes. Well, I understand there's no copay for this. Oh, I apologize, Mr. Parra. And they gave me the money back.
Well, and you know what happens sometimes? Somebody
Yeah.
will come in for a free preventive visit, and the doctor might ask them, what's going on. Then the person starts telling them about symptoms.
Right?
Well, then the doctor might be treating a symptom. So then the billing gets confused because it was both.
Right.
So one needs
Separate
to
the two, I would say,
separate the
right?
two, or make sure that the provider separates the two. You
Right. That's
you have to be
important.
careful.
Yeah. We have to go on our second break. Stay with us. This is AARP Arizona Hispanic Connection. Topic today, Obamacare, past, present, future. We'll be right back. Thank you. Thank you for staying with us. This is AARP Arizona Hispanic Connection. Very important topic today. I don't know. I always feel passionate when I talk about Obamacare or the Affordable Care Act or the Patient Protection and Affordable Care Act, because I have to again say, I dealt with this from the very beginning through AARP, of course, my job, my work, and I have to say that I don't think more than 5% of the country literally understood what the Affordable Care Act was. I think if they had taken the time to really understand it, they maybe would have brought more balance to the debate, to the discussion, so that whatever is to happen with this law, there will be a little bit more balance. But when you demonize something, it just throws it off, and nobody listens to it. Actually, people begin to be afraid of that. So, Alan, off the air, you were telling us that there's yet another benefit that we haven't mentioned. What is it again?
Yes. I don't know if you've noticed, but when you walk into your favorite restaurant, particularly a fast food restaurant, on the wall, the calories for the double burger, cheese, and bacon will be posted. And that's part of the Affordable Care Act, that calorie counts in restaurants for the food they sell must be available to the consumers. And most people don't realize that is part of the Affordable Care Act. And the reason I bring it up is it's much broader than people think.
Right.
It covers more things. It's not just the marketplace.
Right.
So, again, I don't know that I will miss that if it were to go away. But the coverage for people with comprehensive benefits is what's
if
critical.
we remember, I think the arguments against the law was, the individual mandate. You're forcing me to buy insurance. You're forcing me to buy what I don't even need. That was one argument. And then there was it was the individual mandate, and then the access expansion was, I think that was also, actually originally it was a mandate, and then they made it voluntary.
Through a court decision, you're correct.
That's right. So there was a mandatory for individuals, mandatory for the states to expand Medicaid, and then there was a court decision, what have you, and then it now was optional. And Jan Brewer, a Republican, went against, I think, her party, but
Most of her party,
and decided to expand Medicaid. I think she saw it from maybe a financial perspective, possibly.
She saw it from a financial perspective, but she also had a family member with special needs.
Interesting.
And she understood the incredible importance of how does a person with a chronic condition get coverage.
Right.
So she had both the head and the heart.
If anybody's listening to us and would like to call the station to ask a question, I should have mentioned this since the beginning. 602-759-1910, 602-759-1910. Give us a call, and we'll be happy to at least try to address your question. And going back to you, Ms. Maldonado, there is within every type of insurance, the open enrollment concept and the special enrollment concept. People don't just sign up whenever they want to. People shouldn't have the thought that, I'm not going to buy insurance, and as soon as I get sick, then I'll buy it. Can you share with us a little bit about the open enrollment and then the special enrollment?
So the open enrollment period is when anybody who is interested in looking at the marketplace plans can go in and then select a marketplace health plan. So it's important because this is kind of like your open time. If you're curious, you want to understand, you want to see, this is a really good time to do that. And if you want to enroll. So that time period is from November 1 to December 15. So right now we're in it.
Right.
We are in it. And my organization, we have Saturday appointments for people because we understand people are working. They can't always make it during the week. So we actually have Saturday appointments available for the community. And so you have this window of time to go in and purchase. Now, when that window closes, there are certain options to you even outside of that, but you have to meet certain guidelines. So there are certain rules that you have to meet if you want to purchase health insurance outside of open enrollment. So
which fall into the special enrollment, right?
That's correct. So
what would those be? Like if somebody has a child, perhaps? Like
yes. A lot of them kind of coincide with your employers.
Okay.
So if you had a child you move or if you lost coverage. So there are certain ones that will allow you to go into the special enrollment period.
I have a recollection that it's linked to, it's called
Life-changing event.
Life-changing events.
That
Right?
is correct.
I kind of had a recollection about that. So it has to be a live,
And another way to look at it is that if your family size changes, birth, death, divorce, that will usually qualify you.
That is correct.
Right.
So we want to make sure that you have this opportunity to do it from November 1 to December 15th.
Right.
Now, if you are outside of that in open enrollment period, we want to make sure that, if you still want to explore those options and see if you fall within a special enrollment period, you can also always talk to a navigator year round. So
Right.
the navigators are not just available from November 1 to December 15th. We're actually available all year round, which is really important in case you have questions outside of the open enrollment period.
Right. Alan, help us understand something, because I thought in Arizona something very unique happened, and that is that early on there was a coalition of over 100, I want to say, over 100 organizations came together to form what is the name of the?
Cover Arizona.
It's Cover Arizona.
And at one time we had about 600 to 700 members.
600 to 700 statewide.
And let me just mention that because it shows that there are many, many, many different organizations, whether it be hospitals, community health centers, organizations like Keo Health Connection and many others, that we're all interested in how do we let people know. But one of the most important things is that Arizona is one of the few states in the country that has a single 800 number hotline and one website where you can go to make an appointment. You can go to make an appointment to see one of Claudia's people, or you can go see somebody in Flagstaff. And that phone number is 800-377-3536, or just go to coveraz.org. Coveraz.org. Put in your zip code, and you'll find a navigator, a sister close to you.
This to me was an amazing concept that this several hundred organizations came together, and that you had the idea to form this coalition. You had I think you also have a Facebook page.
Or we have Facebook page, and we have educational webinars for the stakeholders. And what it means is that Arizona was concerned about getting as many people covered as possible. And this is a voluntary effort through many organizations. And like I say, we were lucky to get cooperation. So there's just one number to call and one website rather than 100 different numbers.
This is an amazing thing that happened in Arizona. It's still going on, and the plan is to continue it, correct?
Yes. And I should mention that the people that answer the phone are community health workers that are bilingual. And they're promotores.
Right.
And they are there to help and guide and make appointments.
Yeah. To my recollection, the following point did not exist before the Affordable Care Act, Obamacare, and that is the out-of-pocket limits. I believe that that's another huge protection, because I heard that the number one reason why people go bankrupt is because of medical bills. Think about that. The number one reason in America that people go bankrupt is because of medical bills. So the Affordable Care Act comes in and says, you know what? We're going to set an out-of-pocket limit. And sometimes the word limit tends to have a negative connotation, but in this sense, is an extremely positive thing. Can you explain, Alan, what the out-of-pocket limit is?
Sure. When you get employer coverage or when you buy in the marketplace and you're comparing plans, obviously your monthly premium is important.
Right.
Your deductible, the amount you have to pay before insurance even starts to really work. But the other third thing that is so important is out-of-pocket maximum or limit. What that means is if you spend out of your pocket, let's say you have a plan where the out-of-pocket maximum is $10,000 and a family member has a serious illness or injury, every bill after that $10,000, your insurance company pays 100%. So you have a maximum liability, maximum amount that you could pay. And that is really, like you say, unique. Group plans all have that now.
Right.
And anybody that buys in the Affordable Care Act has it. Do you know who does not have it? People on Medicare.
And you know what? Except for Medicare Advantage plans. Medicare Advantage plans do have an out-of-pocket max.
But the other plans don't.
Right, the original Medicare. Just like with my work, I have an out-of-pocket max, and that's important to me. So again, people, the less money you have, the more help you get. So we have to go on our 30 seconds, and we'll have to go on our last break. What is the Claudia, the some of the out-of-pocket max? What are we talking about here? Because I believe I used to see those numbers before. Some plans had a $6,000. I think that's the most I had ever saw. Do you recall? It doesn't. I assume it varies, right? As to the
I would
out-of-pocket
say it
max.
varies, but I can't remember. Alan,
Well,
do you remember?
I can say that it changes every year. The federal government does some calculations. I think the maximum this year is high 6 or low 7,000. But some plans are much lower than that,
Right.
depending on the plan you pick.
Right, right. And this is something that is very important. And I obviously, KIO and all the agencies that help folks to sign up for plans, that's how they help them, to consider, would you be willing to pay a lower premium for a lower deductible and lower out-of-pocket max? But if you pay a little bit more premium, maybe you get a lower deductible, and then a lower out-of-pocket max. So you have to find the right formula for each case, correct?
That is such an important point that you make, because I know you have to go to break, but we can definitely talk about this more. Why is this important to families?
Continue. I think we can steal another minute.
All right. So why is this important? Well, it's important because if you take into consideration somebody's income, the number of people in their household, you want to make sure that they are buying a health plan that is truly affordable, that meets their needs medically, and that is going to meet, their budget needs.
Right.
So we actually do little scenarios, like what if? We sit down with the family and we say, what if this happened? What if you needed surgery? What if you needed to go to the hospital? How much are you actually going to pay? And then we actually do the calculations with them and say, are you okay with this?
Right.
And it's amazing how you can see the family say, you know what, maybe I'm better off with this plan versus this plan, because I can do this, but I cannot do that.
The great thing about the Affordable Care Act is that it brought more options to folks, and that's the great thing. Stay with us. We are going to take our last break. This is AARP Arizona Hispanic Connection. The topic today, Obamacare. Oh, no, it sounds a lot better than it used to, right? Obamacare, past, present, future. We'll be right back. Thank you. Thank you for staying with us. This is AARP Arizona Hispanic Connection. Topic today, Obamacare, past, present, and future. We I want to say this is like breaking news, to be frank with you. I don't believe a lot of people know about this and I got to know. I'm signed up with a Casey Family Foundation, and anybody out there that likes to keep themselves informed, sign up to get alerts from the Casey Family Foundation. They're just one of the best in terms of putting out good information. And I got this alert from them, a fact sheet, and they talk about the concept that starting in 2020, the CMS, I think it's safe to say it's CMS, HHS, and then the president, of course. You go from the president, HHS, CMS, Affordable Care Act. They are now going to allow those states who do not run their own marketplace. So Arizona is one of them. California is not. California runs its own marketplace. Arizona decided to allow the federal government to run its marketplace. Well, states like Arizona, in those states, the government will allow now for insurance companies to basically include in their offerings the marketplace plans and also what they're called the web brokers. So can you elaborate
Sure.
a little bit more, Alan, on that?
So, first of all, those insurance companies that are selling in the marketplace, and there's only 5 in Arizona, they can add a link to their website to go through a third party that will calculate how much a person would have to pay, how much financial aid they get, and basically it's a direct link to enrolling in Affordable Care Act coverage. In the past, that was not possible. Large broker groups or e-insurance type groups, there are many different online insurance groups, can now offer a direct link.
Right.
And you'll still get the same product at the end, but one has to just be careful to make sure that there's no confusion about, is this healthcare.gov qualified health plan or is this some other product? And so there are many, many legitimate links that will get you just what you need. But I have to say, there's stuff out there that's very confusing. Unscrupulous sales organizations will do anything to make their product look like it is an Affordable Care Act plan, even though it may not be.
So I also understand that the way they show you that information on their websites can be a little bit different than what you would see on the Affordable Care Act, to kind of give prominence to some elements that would point people to their plans. That's one thing I read. Another thing I read is that for the subsidy that folks would be able to, or would be eligible, not all those sites are going to allow you to calculate that subsidy, and some will actually you have to go on a separate process, if you will, to the Affordable Care Act or healthcare.gov, to be more precise, to process that. Right. That could get pretty crazy.
It could be confusing. So again, like you said, there's variance. One way to deal with this is go to a health insurance navigator or a sister. They are paid not by the insurance company. So they're not going to favor one company over the other. They're going to give you the straight information, but they cannot make the decision for you.
Right.
For example, Claudia can ask you questions and get you down to, say, 2 or 3 plans. But then she's going to say, David, you have to make the choice. But she can walk you through what's
Right.
important.
And that's really the most important piece as navigators. We're not there to persuade you. We're not there to have a bias. We are simply there for your best interests. And we want to make sure we lay out all the information for you in an appropriate and educational manner, and really let the consumer make the decision, because we're not there, we don't receive commission, none of that. We're just really there to help guide you into what makes the most sense for you and your family.
Yeah. It's very interesting to make this clear, because I'm sure many out there might not know. But what is the difference between a nonprofit navigator, let's just call them like that, because I think that's what you are, nonprofit navigators, the staff, that's if they're not volunteers, because I'm sure that some of the agencies have volunteers. But if they are staff, they get paid by the company, by the nonprofit, and they do not make commission on how many people you enroll.
Absolutely correct.
Whereas an agent, there's nothing. I usually say it in Spanish: no es pecado ir a un agente, right? It's not a sin to go to an agent or a broker. It's perfectly legit. But those folks make their money primarily on commission. What does that mean? Well, you figure it out. Will that agent be fair to you? We can't guarantee it, but they make money. They have to also eat as we do. So there may be a little bias towards a certain plan that might, and that actually, that's the danger also on those plans that are going to be sold in on the insurance companies' websites or the brokers, that they may do it in a way that kind of leads you to the plans that will give them the most, what's it called again? The commission.
Right.
So be careful.
Right.
Just know what you're doing. Know ask the questions.
Ask the questions, and if you have a trust relationship with an insurance broker,
Right.
somebody you've known for years, they're going to do you right.
Mm-hmm.
But if you just select a name from some list, you have no idea who they are, just be extra careful, because when you ask the question, David, which policy is best for me,
Right.
a broker can say this one,
Right.
no matter what it is.
Mm-hmm.
If you ask that question of Claudia or I, we're going to say, well, these 2 or 3 will probably meet your needs, but it's your decision.
Right.
And the difference is if you rely on somebody else telling you exactly what you should buy, you're opening yourself up.
Right.
That doesn't mean it's bad. It's just the way it is. And so again, do you have a ongoing relationship, and do you trust that broker, or it's just a name that you picked off the web?
Yeah. Go ahead.
Oh, the other thing I also want to mention is think about it. If you go on healthcare.gov, and you're looking, they're going to give you all the options, right?
Right.
You have everything.
Right.
With these other websites, that may not be the case.
That's right.
They may not show you all the options that are available to you. So just think about it in those terms too, is that healthcare.gov will show you everything. And then you can pick, from whatever they tell you, this is what is available to you. And those other websites, they may not.
And not only it's not a matter of will, even by law, they are allowed to do that. They don't have to show you the information in the exact same way as the affordable or healthcare.gov does. So
Correct.
be mindful of that, and like Alan says, if you know the person, if he's your friend or she's your friend, I'm sure it'll be fine. But I have learned over the years that most people are still not versed on insurance concept. We've been educating for years now, and I get phone calls and I get the impression, even though we've done it for many years, a lot of people do not take the time to really understand it. So you want to go to somebody that you really trust and that you really that is going to tell you all the facts, and that is super important.
And somebody that'll take time to give you the facts, because your monthly premium, your deductible, your copays, and your out-of-pocket maximum, if you understand those things, you're probably going to be in pretty good shape. We will take the time, the navigators across the state, to explain that to you.
Right.
It's overwhelming, and you usually don't understand it until you get sick,
Right.
or end up in the hospital.
And I was just thinking about another thing. If you're an insurance agent or broker, you wanna take care of clients fast, because that represents commission.
Time is money.
Right. If you are a nonprofit, you're not making commission, so you obviously are going to be inclined to make sure that you spend the adequate time. That's another factor, I
And
think.
it's also, that's part of the rules.
Yeah, that's
We're
part.
obligated.
We're obligated to do this. So we want to make sure that when you do meet with a navigator, that we do take our time. Sometimes it does take multiple appointments, but that's okay. We have the time to see you and to make sure that you understand exactly what you're getting into. Because the worst thing that you can hear of, and we've seen it, is maybe somebody didn't go to a navigator, and then they somehow find out about you, and they say, but I got this bill for X dollars. And then you're sitting there explaining to them, the health literacy piece is so important. You know what? It's because you have a plan with X, Y, and Z.
Right. Can you repeat, Claudia Maldonado, again, the the dates for open enrollment. We're up just about 45 seconds. We still have enough. If you can just repeat the dates or the days. Well, days. We don't have a full period now. I guess we're underway, right?
So the open enrollment period runs from November 1 to December 15th. So we are almost halfway through the open enrollment period. So you only have until December 15th to sign up for the health insurance
Right.
marketplace.
And you can go to cuidadodesalud.gov, healthcare.gov to get numbers, or you can go to coveraz.org, coveraz.org, or the number real quick.
800-377-3536 and bilingual.
Thank you, Alan. Thank you, Claudia. It's been a great show today. We hope you enjoyed it. Don't forget, we're going to be at the tailgate at the ASU game. It's starting at 1:30. It's a local game. See you there. And also see you next time for another show. Take good care of yourselves.